I love it. I love this job. It is very rewarding. It is challenging. I love coming to work every day. I'm Elizabeth Dicey, and this is my school, Eastport Elementary. So I was a medical surgical nurse first. That's how I did my nurse residency. And then I moved to labor and delivery, and then moved to school health. So a lot of variety. There's a lot of the medical surgical experience in school health because you're taking care of the whole body. There's a lot of that compassion and that family building.
If I could not be a nurse, I wanted to be a teacher. As a school nurse, I get to do both. I am Tamla Williams, RN, school nurse at Van Bachman Elementary. I get to care for kids who are sick. I get to help parents care for their kids who are sick. And I get to teach the kids. Those few minutes that they're in my health room, whether we are helping them take care of a cut or we're helping them calculate their dosage for their insulin, we get to teach. And I enjoy doing that. And that's a big thing for me. And just to see the light bulb goes off in their head. I got it. So I love what I do.
It's really, really nice to work in the community. You know, you have a difference on the kids' lives and educate them and see them grow. My name's Sarah Scholl. I'm the school nurse at Sunset Elementary and High Point Elementary. So school nurses, they do a lot. We do a lot of the day-to-day like medical care with seeing the kids, a lot of like the boo-boos and Band-Aids, but it's a lot of case management as well. So identifying students that may have chronic health conditions and helping parents find resources. A lot of kids, you know, may be diagnosed with things at this age, so it's new to them and it's new to the parents. So it's a lot of education and trying to, you know, teach them how to have a normal day-to-day in school, but still learn about their condition and how it affects them.
Oh my gosh, I love it. Every day is a new adventure. My name is Tammy Udenbach. I work with special needs students from special needs all the way to high school in the health room. With special needs, I have children with ventilators that are coming to school. So I'm working with a ventilator, I'm working with feeding tubes, I'm working with suction equipment. Every day, who knows what's going to come through. So you have to be adventurous.
No day can ever be predictable. I enjoy that aspect of it. It's very exciting. You're never bored. My name is Melody Browning. I am the school nurse at Overlook and Brooklyn Park Elementary Schools. I personally chose to be a school nurse because of my family needs. It was very important to me to be home on holidays. It's very important for me to be home on the weekends and see them. And at night to, you know, have that predictable schedule so I could be there for their after school activities. It's not always, and when you're in a hospital, you don't have that predictability necessarily, or you don't always get to pick your schedule per se.
As a school nurse, you have a lot of autonomy that you don't have in a hospital setting. And as a school nurse for our county, we have these clusters of nurses in the area. So I have a variety of nurses that I can call on at any moment to say, hey, have you ever seen something like this? Or what would you do in this scenario? So there's a lot of teamwork, but a lot of autonomy at the same time. This is sort of my space, and I can create it and help these families in every way that I can.
So there's a health assistant in every health room. So there's one health assistant in each elementary school, and they're there full time. It's very helpful.
As a school nurse, you really do form a close relationship with your health assistant. I couldn't do my job without my health assistants at all. You trust them. I mean, I value my health assistant because I know they always have my back and I have their back if there's ever an emergency situation.
I love working with kids. Kids are my thing.
When you see that light bulb go off and they understand, or you're able to tell mom that, hey, I can get you a voucher to help you get eyeglasses, and you see the child come in school with their eyeglasses and they're doing well now that they can see, yes, it's rewarding. If we're able to tell people where they can go and get tested, they didn't know they can get tested, oh, I can tell you where you can get some free kits. Yes, it is rewarding just to be able to help them.
The schedule is fantastic. but I really like getting to know each of these kids. You get to know your patients in a way that you don't in a hospital setting, and that's pretty awesome.